Please step over here. Tell us who you are, where do you live, and what's on your mind?
Hello, my name is Linda Southard, and I live in Candler. And my question is, we have been told how we can go on these marketplace exchanges and we'll be able to compare plans and prices side by side. However, when you go on the North Carolina exchange, no offense to Blue Cross and Blue Shield, but pretty much that's the only choice you have. So my question is, why is that, and will that change?
Good question, Alec.
We are the only company that's covering all 100 counties in North Carolina. There is one other company, Coventry, that's covering 39 counties. 7 companies were approved to offer insurance on the exchange in North Carolina and declined to do so. One of the reasons, it could be the lack of Medicaid expansion. That what that means is there's a lot of people with lower incomes and higher health issues, and those companies didn't want to take them on. The fact that we're the only company that went to all 100 counties, I can't speak for the other companies. I can say that being a North Carolina-based company that wants to provide service to all of North Carolina, we felt that was our duty. But for the other 7 companies that are approved and decided not to move forward with that, I can't speak for why they didn't go ahead.
And before I follow up with Donald, just a quick data point so everyone understood this. In North Carolina, 39 counties, the people who go in the exchange have an option of selecting from 2 insurers. In the other 61 counties in North Carolina, they only have 1 insurer to pick from. North Carolina is not the only state like that. The state of New Hampshire, they only have 1 choice. In Alabama, 96% of the counties only have 1 choice. It varies across the country, but in many states, oftentimes the public only has 2 or even, in many cases, only 1 insurer to choose from. Donald, I want to follow up with you. How much does this complicate the process when there is not that choice available to the public?
Well, you know, the beauty of the American marketplace is choice, is that companies can compete with each other, and then the only way they can compete for more customers is lower prices and better customer service. But with the regulations under the Affordable Care Act, companies, you know, you heard him, 7 companies opted not to do it. The other company that's available in North Carolina is Coventry One. I believe the other company that initially accepted to be on the exchange was Carolina One Health or something like that. And then they were about to start the exchange, and then they said, no, we don't want any part of it. The idea of insurance is that you pay the insurance company and they accept you on as an insured client due to the risk of you being healthy, and that they'll eventually pay out for your health, you know, for your health care when you need it. These companies just don't want to take the risk, and they don't want to, you know, the regulations combined with who they're being forced to take on, they just didn't want to take the risk, nor should they be forced to do anything, you know, up to a certain point.
And before I go to this young lady for a question, I want to share with you just a recent poll that was taken here in North Carolina by the Public Policy Polling Organization on January 14th. And in terms of favorability or support of the Patient Protection or Affordable Care Act or Obamacare, 38% of North Carolinians support Obamacare, 48% oppose. Let's go to this young lady. Please tell us who you are, where do you live, and what's on your mind?
My name is Janet Presson, and I live in Waynesville. I'm the owner of an agency that employs over 600 North Carolinians, and as soon as Obamacare, well, affordable health care was passed, our health insurance rates went up 24% in 2011, 35% in 2012, and we were told they're going up 26% in 2013. That's an 85% increase in 3 years. I don't want to point any fingers, but our gentleman from Blue Cross could probably answer this question. What's going to happen in the next 3 years? Are we going to see another 85% increase? Because we were paying half and our employees were paying half. We can't afford those increases. Our employees can't afford that increase. And then the other prong of the question is, if we're all being forced into affordable health care, the IRS and other government folks are going to be deciding what we get and what we don't get. Are we going to next be forced into forced vaccinations, mandatory mental health screenings, things like that? I mean, healthcare workers are already being forced to have mandatory flu vaccines. Is it going to be restaurant workers next? You know, teachers next? We're going to lose, I'm really afraid we're going to lose say in our health care, and I'm also an RN, and I don't like that. So, I mean, somebody can answer about the rates continuing to increase, and then about us losing our right to decide what we want and what we don't want for our health care, because I think we're really going to lose that.
And you said you didn't want to point fingers, but let the record reflect, you did.
I had to.
You
Who's
did.
there?
Okay, and so Alec, let's talk about the rate increase, because certainly I would think the insurer would be sensitive to that for a number of reasons. But can you talk about the rate increases and what you've seen?
Sure. Let me start off by saying I concentrate on the individual market, not the group market. So I'm going to try to give you the best answer based on my knowledge base on that. There's a number of additional benefits that all plans have to cover now. These are known as essential health benefits. So there's a number of things that previously were not covered or that you could pay extra to have covered. They were known as riders previously, things such as maternity, additional mental health services, things like that. Moving forward, all plans have to cover at a minimum level these 10 essential health benefits. What that means is that a number of plans that were under those minimum levels had to suddenly raise up their benefits pretty significantly, which caused the rates to go up to cover those additional services. If it's going to be the case moving forward, the goal was, and the idea was, that there would be a big bump initially as all these added benefits came into play. But once you got everyone into the system, once you had the healthy people in there as well, not just those that needed the insurance, but everyone in the system, that the increases would either level out or over time go down. Now that's something that it's long term. This law is very complicated. There's a lot of different moving parts on this. So until it plays out for a few years, there's no way to know what is going to happen. If it works out like they hoped when they wrote the law, then yes, the rate increases should not continue as they have. But until we see what happens with the market and who joins on these plans, it's going to be impossible to say.
I want to follow up with Cody on this for a moment, and just again, News 13 is not taking a position in this debate. However, in our research, we found, here's one example that this is something that this young lady addressed. If you take a look at individual policies, if a single man purchased an individual policy, he must have in his policy anemia screening for pregnant women, breast cancer screening for women, breastfeeding counseling, cervical cancer screening, 13 more female-only procedures, and 6 child or newborn-only procedures. So, Cody, does it make sense that we would require someone who clearly perhaps would never use those services to purchase them? Or is it really just what insurance is all about, and they have to have everything?
I don't believe it makes sense. Hospitals in North Carolina employ 192,000+ people. We have to have the same requirements for our employees as well. It makes more sense to give employees and all of us the options of those additional services, because we noticed when we required healthy middle-aged men to have maternity coverage, everybody's policy went up, when middle-aged men have never, ever, ever needed maternity coverage. So, no, I don't think that's reasonable.
Leslie, I saw you shaking your head. Did you want to weigh in on this?
What I do want to say is I don't think you're going to lose your health care rights, your rights to decide. Sometimes, yeah, if you're working as a nurse and you haven't had a flu vaccine, you can not only get the flu but spread it to your patients. It's a matter of safety. It's not a matter of, oh, I don't want that. It's a matter of, if you can spread an illness that could be fatal to your patients, then you need to have that vaccine. And if you don't want to have that vaccine, this is what's called a right to work state, which means you really don't have a right to work.
But then you start with all the different vaccines, and you have to get them every year. And a lot of these vaccines are not safe and they're not effective. Most of the vaccines given in this country contain either formaldehyde or formalin, which is a known carcinogen. Then you wonder why so many people have cancer. Many of them also contain neurotoxins such as aluminum or mercury.
We have to address that. We have to address that.
And then, okay, it's just healthcare workers now, which is wrong. And some states are not giving any exemptions. Some hospitals are not giving any exemptions, even for medical and religious reasons, which again is wrong. We're losing our rights bit by bit by bit. It's like duck bites. And then all of a sudden, then it's going to be teachers because they can spread diseases. And then it's going to be people that work in stores and people that work in grocery stores. And then it's all of us, and they're going to line us all up every year.
All right, and let me go ahead and bring Donald into this discussion. So her concern is, and that was the second part of her question is, she's arguing that there's a loss of the freedom to choose by people. Is that a legitimate concern?
Absolutely, it's a legitimate concern. You know, it all dials back to the individual mandate under the Affordable Care Act, and other nations have implemented an individual mandate, and if we're going to have one, we should look to the models that have actually worked in other countries. I'm not saying I endorse the individual mandate. I think it's terrible to require individuals to purchase something under penalty of law. But if we're going to do it, Switzerland and Singapore have both had great success with an individual mandate. It only requires that they have the catastrophic coverage, and healthcare costs as part of the GDP in both of those countries have gone down. And in Switzerland in particular, it's really worked. The percentage of GDP is similar to what it was in the United States. It was about 15%. They've gone down to around 7 or 8% at this point. They're about the size of the state of Massachusetts, which has 3 insurance companies now. The nation of Switzerland now has 54 insurance companies who are all competing for a very minimal synthetic marketplace, and they can only compete with each other with better customer service and lower prices, and that's what we've seen in Switzerland.
And before I go back, follow up, just one more thing with Alec. We have so many insurance companies in this country, big and small. Why is it there are so few choices in each state?
Part of the reason is you can only sell within the state as far as the individual policies go. You can only sell in the state where you're located. So for example, Blue Cross and Blue Shield North Carolina can't sell policies to people in South Carolina. We can't sell policies to people in Virginia. So we're limited by geographic regions. The other reason is some companies don't want to go into certain states based on the health of the state, based on the size or their capacity to handle a certain number of people. They're going to concentrate on only certain markets. So those 2 factors play a role. With group policies, it's a little different. You can sell group policies because companies do have offices all over the country. Group policies can cover people throughout the country. So you can see more competition in that.
And that's a federal prohibition that doesn't allow selling of insurance health insurance across state lines.
Correct.
In your opinion, if that law was changed, would it be positive for the consumer?
Yeah, honestly, I don't know. I think that it could be by giving them more options. I think there's a number of different plans that come in. I think we're a great company. I think we'd do very well outside of North Carolina. But if it would make a significant difference in options or price, I can't say I wouldn't.
I see Cody shaking his head, so he believes it does.
I do. I think if you look at the economics and going back to having a broader pool, if a company is able to have not just North Carolina in their pool, but the entire Southeast if they choose, I believe that'll lower our insurance rates and give us more access because it'll increase the amount of healthy people that an insurance company could have in their pool.
All right, now the control room tells me a lot of people are really weighing in on this issue on Facebook and Twitter. Before we go back to Frank and the digital desk, I want to get one more question in from our audience. Please tell us who you are, where do you live, and what's on your mind?
Sure, I'm Nancy McDonald and I live in Hendersonville. And I have a simple question. I've gone to the website a couple of times and I had questions while I was trying to enroll, and I wasn't sure who I could talk to help me through the enrollment process with my questions.
All right, and just before we get to the panel, by a sound of applause, how many navigators do we have in the room tonight? Okay, so even if we don't get a question from the panel answer your question, I think we may have 1 or 2 people here who can help you before the night's over, okay?
Thank you.
Let's go to the panel. So you clap, Leslie, you're a navigator.
Yes, I am.
How does someone like this get assistance?
There is a number you can call. I'm really bad at memorizing numbers, but it's out there on the table. Susan, you've got some of those papers left, I think, that have the number. There's one number, it's a toll-free number that you can call, and the person there will direct you to an agency that has navigators in an area where you live, in your county. So it's one number, you can call it, they'll direct you to the agency, you call the agency, and you've got a navigator.
And if you have questions, News 13 will find the answers for you. But I'll tell you, it would be great if any of those navigators could speak with this young lady afterwards. Perhaps you might be able to answer some of her questions before she leaves tonight. But a lot of folks at home have questions, so let's go to our digital desk. Frank, what do you have for us?
Well, Mark, you are absolutely right about people wanting to weigh in. We have over 500 posts now on our Facebook page. I'm going to share a couple of those with you, as well as what we're getting on Twitter right now. On Facebook, Ashley Moore Priest writes about whether or not we have affordable health care. She says, no. This time last year, my husband and I were paying $56 a month for the best plan Cigna had. Now we had to go with BCBS and having to pay $482.49 a month for the lowest amount of coverage, We have to choose between health care or paying our rent. Healthcare won. Another comment comes in from David Joe Miller. There is no such thing as quality health care at affordable prices. It's not Obama. We didn't have it during the Bush dynasty or Clinton era. Healthcare needs to be overhauled. ACA is nowhere near perfect, but it's a start in the right direction. It's going to be painful, but in the end, when the dust settles and tempers ease off a bit, I truly think they'll be able to shape it up into something doable for all. Now let's take a look at what's coming in on Twitter right now. We're getting some questions there as well. And one of them is from Ashley Ann Larson. She says, to Leslie, 99% of the premiums exceed the total income that people receive. We've got some other comments there, but I want to show on the screen a couple of comments that came in to our website. This one comes from Tammy Blevins. My employer will be freezing our paid time off accrual and giving no raise this year because of it. Yeah, I love it. And also, Robbie Brackett writes, people need to read the law. Don't go by what people tell you, and educate yourself on what is truly happening. We also have a question from Twitter, and this is from Joe Stafford, and he posted in our town hall at hashtag WLOS Town Hall, and he writes, my wife is on Medicare. Do I have to include her income when trying to figure out coverage?
What a great question. Alec, are you familiar with this issue?
So when you're putting your income, they want your modified adjusted gross income for the entire household. So whoever's on your income tax form. Now, modified adjusted gross income has a few differences from your standard gross income. So if she's on Medicare, it depends what income sources she has. Things like Social Security, if she has a pension plan or retirement plan, there could be some things that go towards that modified adjusted gross income. What they can do is they can speak with a navigator, they can speak with us, and we can help, based on their situation, help them figure out what would be the correct answer for that.
Quick follow-up. If they file separately as individuals as opposed to married couples, does it make a difference?
Yeah, it makes a very big difference. If you're married and you file separately, you automatically exclude yourself from getting subsidies to help pay for your insurance. So even if you qualify for subsidies, if you file separately, you cannot get those subsidies.
Very good. Thank you very much.